Hey, I'm Dr. Ryan Westbrook, and I want to talk to you about something that affects 1 out of every 3 American adults: high blood pressure. Now, most people think that managing their blood pressure is all about taking medication and checking numbers at the doctor's office. But here's the truth that nobody talks about. What you eat every single day has more control over your blood pressure than almost anything else you do. And today, I'm going to show you the 10 worst foods for your heart that might be sitting in your kitchen right now. Some of them you probably eat every week without even realizing what they're doing to your arteries. By the end of this video, you're going to know exactly which foods to swap out and what to replace them with. Plus, we're going to discover the one food hiding in your kitchen that shocked even me when I found out how much damage it does to your cardiovascular system. Let's start with something that everyone thinks is healthy, but absolutely destroys your blood pressure. Are you ready? Let's go! Before we talk about the specific foods, I need to explain why your food choices matter so much. Your blood pressure is the force that your blood exerts on the walls of your arteries. When that pressure gets too high, it damages those delicate artery walls. And over time, this damage leads to heart disease, strokes, and kidney failure. Most of my patients think they're going to develop high blood pressure because they're stressed, or because they're getting older. And sure, those things matter. But the biggest factor, and I mean this, the biggest factor is what's on your dinner plate. When you eat foods high in sodium, saturated fats, and processed sugars, your blood vessels become stiff and inflamed. Your kidneys struggle to regulate fluid balance, and your nervous system stays in a state of constant fight or flight. The scary part is that high blood pressure is silent. You feel fine. You have no symptoms. So you keep eating the same foods day after day, and meanwhile, your arteries are becoming damaged. By the time you feel something wrong, the damage is already done. Now, the good news is that changing what you eat can lower your blood pressure in as little as 2 to 3 weeks. I've seen patients drop their blood pressure by 15, 20, even 30 points just by eliminating the foods I'm about to tell you about. Let's start with number 10. And this is something that millions of people eat for lunch 5 days a week: deli meats and processed lunch meats. I'm talking about turkey, ham, roast beef, salami, pepperoni, anything that comes sliced in a package from the supermarket. These foods are absolutely loaded with sodium. A single serving of deli turkey can have between 600 and 1,000 milligrams of sodium. For perspective, the American Heart Association recommends that you consume no more than 2,300 milligrams of sodium per day. That's your entire day's worth of sodium in one sandwich. But it gets worse. Deli meats don't just have salt. They're preserved with nitrates and nitrites, which are chemicals that your body converts into nitrosamines. These compounds damage the lining of your blood vessels and make it easier for plaque to stick to your artery walls. What happens next is your arteries get stiffer and narrower. Your heart has to pump harder to push blood through those constricted vessels. That increased pressure is high blood pressure. The solution here is simple. If you want a sandwich, use real sliced turkey that you roasted yourself. Or use grilled chicken breast, or even tuna canned in water. You control the sodium. You control the quality. Your blood pressure will thank you. Number 9 is canned soup and canned broth. I know soup sounds healthy, right? It's warm, it's comforting, it has vegetables. But open up a can of chicken noodle soup or tomato soup, and you're looking at between 800 and 1,200 milligrams of sodium in a single serving. Here's the problem with processed soups. They use salt as a preservative, but they also use it to make the soup taste good because the processing removes a lot of flavor. So the manufacturers compensate by loading it with salt. Now, most people eat the entire can in one sitting, so you're consuming the full sodium content at one meal. Your kidneys get overwhelmed. They can't handle that much sodium all at once. Your body retains more water to dilute the salt. That increased fluid volume in your bloodstream means increased pressure on your artery walls. Plus, most canned soups are also high in processed carbohydrates, which spike your blood sugar and create inflammation in your blood vessels. The fix here is to make your own soups. I know that sounds time-consuming, but homemade vegetable soup or chicken soup takes maybe 30 minutes to make, and you can freeze it in portions. You control every ingredient. Or if you're in a hurry, look for low-sodium broth options. They exist. You just have to read the label. Okay, we're getting to the big ones now. Number 8 is the one that shocked me, and I think it's going to surprise you too. Bread and baked goods. Most people have no idea how much sodium is in their bread. A single slice of regular white or wheat bread from the supermarket contains between 100 and 200 milligrams of sodium. That's more sodium than a serving of potato chips. Think about how much bread people eat. A sandwich is 2 slices, so that's already 400 milligrams. Add a roll to your dinner, and you're at 600. Have toast for breakfast, a sandwich for lunch, and pasta for dinner. And you've consumed between 1,000 and 1,500 milligrams of sodium before you even add salt to anything else. But here's what really gets me. People don't think of bread as a salty food. They think it's neutral, so they don't account for it. They add salty butter, they add cheese, they add processed meats, and suddenly, one meal has 2,000 milligrams of sodium. The other problem with commercial bread is that it's high in refined carbohydrates. These refined grains spike your blood sugar quickly. High blood sugar increases inflammation in your arteries, makes your blood vessels less flexible, and contributes directly to high blood pressure. The answer is not to eliminate bread entirely. It's to switch to whole grain bread and actually read the label. Look for bread that has less than 100 milligrams of sodium per slice. They're out there. And better yet, if you have time, make your own bread. Homemade bread is a game changer. Number 7 is cheese and full-fat dairy products. I love cheese. I get it. Cheese is delicious. But most people dramatically underestimate how much sodium and saturated fat is in their daily cheese consumption. 1 ounce of cheddar cheese, and that's not a huge amount, maybe the size of a dice, contains about 190 milligrams of sodium. But more importantly, it contains about 6 grams of saturated fat. That's a lot. When you eat saturated fat, it increases your LDL cholesterol, the bad cholesterol. This cholesterol sticks to your artery walls and causes plaque buildup. This plaque makes your arteries stiff and narrow. Stiff, narrow arteries mean higher blood pressure. Plus, many people eat cheese multiple times a day. Cheese on eggs for breakfast, cheese on a sandwich for lunch, cheese on pasta for dinner, plus snacking on cheese and crackers. That's potentially 3, 4, maybe 5 servings of cheese per day. You're looking at 1,000 milligrams of sodium and 20 to 30 grams of saturated fat. Here's what I recommend. Reduce your dairy, not eliminate it. Switch from full-fat to reduced-fat cheese. Use smaller portions. And when you do eat cheese, pair it with vegetables and whole grains to slow down how quickly your body absorbs the fat. Also, look into alternatives. There are some really good plant-based cheeses now that are lower in sodium and saturated fat. And good old yogurt with fresh fruit? That's a much better choice than cheese on crackers. Number 6 is condiments and sauces. This is where people get absolutely blindsided. A tablespoon of ketchup has 160 milligrams of sodium. Soy sauce has 920 milligrams in just 1 tablespoon. Barbecue sauce, hot sauce, salad dressings, they're all loaded with sodium. Here's the insidious part. People don't count condiments as part of their sodium intake. They think, oh, it's just a little ketchup, or it's just a tablespoon of soy sauce. But if you eat 3 meals a day and add condiments to all of them, you're easily consuming 1,000 to 1,500 milligrams of sodium just from condiments alone. The other problem is that many condiments are high in added sugars. Ketchup is basically tomato-flavored sugar. Most barbecue sauces are 40 to 50% sugar. These sugars cause inflammation in your blood vessels and spike your blood glucose, which increases blood pressure. What I tell my patients is this. Make your own condiments or choose low-sodium options. There are low-sodium versions of ketchup, soy sauce, and salad dressing. They taste almost as good, and they don't destroy your blood pressure. You can also make amazing salad dressings with olive oil, vinegar, and fresh herbs in literally 2 minutes. Number 5 is frozen meals and TV dinners. These convenient little packages are a blood pressure disaster. A single frozen dinner can contain between 1,000 and 2,000 milligrams of sodium. That's sometimes a full day's worth of sodium in one meal. The reason is that frozen meals use sodium as a preservative. They also use it to add flavor because freezing and thawing removes a lot of taste. So the manufacturers compensate by adding tons of salt. Plus, most frozen meals are high in trans fats and processed carbohydrates. Your blood vessels become inflamed. Your cholesterol goes up. Your blood pressure goes up. And the whole meal is done in 5 minutes in the microwave. I understand that life is busy. I understand that sometimes you need a quick dinner. But frozen meals need to be occasional exceptions, not your go-to option. If you need quick meals, buy rotisserie chicken, pre-cut vegetables, and brown rice. Throw them together in 5 minutes. You've got a meal with 1/10 of the sodium. Number 4 is fast food and takeout restaurants. I don't think I need to tell you that fast food is bad for you, but let me give you the specific numbers. A fast food hamburger and fries can contain between 1,500 and 2,000 milligrams of sodium. A chicken sandwich from most chains has over 1,000 milligrams. A small-sized drink with a biscuit and sausage for breakfast has close to 1,000 milligrams of sodium before you even add salt. But it's not just the sodium. Fast food is high in saturated fats, trans fats, and refined carbohydrates. All of these things increase inflammation in your blood vessels, increase your cholesterol, and increase your blood pressure. Plus, portion sizes at restaurants are enormous. You're getting 3, sometimes 4 times the calories that you should eat in a single meal. Your body stores this as fat, especially visceral fat around your organs. This fat produces inflammatory chemicals that directly increase blood pressure. Here's my advice. Fast food should be eaten maybe once a month, if at all. If you're in a situation where you have to eat fast food, choose the grilled option, skip the fries, add a side salad, and skip the regular soda. You can reduce the sodium and calories by 50% just with those swaps. Number 3 is cured and smoked meats. We're talking about bacon, ham, smoked salmon, jerky, and sausage. These foods are salt-cured, which means they're literally packed with sodium. 3 slices of bacon contain about 300 milligrams of sodium. A couple of sausage links have between 400 and 600 milligrams. But the sodium isn't the only problem. These meats are preserved with nitrates and nitrites, the same chemicals I mentioned with deli meats. These chemicals are converted in your body to nitrosamines, which damage your blood vessel lining and increase inflammation. Research has shown that people who eat cured meats regularly have a 30 to 40% increased risk of heart disease. 30 to 40%. That's a huge difference. Now, I'm not saying you can never eat bacon again, but if you're eating bacon for breakfast every day or sausage multiple times a week, you're significantly increasing your risk of heart disease and stroke. What I recommend is limiting cured meats to maybe once or twice a month. And when you do eat them, use them as a flavoring rather than the main protein. A little bit of bacon in a salad is different from eating 3 slices for breakfast. Use smoked salmon as a topping on your vegetables, not as your main meal. Number 2 is sugary drinks and soda. Now, most people know that soda isn't healthy, but I don't think people fully appreciate how bad it is for your blood pressure. A single 12-ounce can of regular soda contains about 40 grams of sugar. That's about 10 teaspoons of sugar. When you consume that much sugar at once, your blood glucose spikes dramatically. Your pancreas releases insulin to bring the glucose down. But this insulin causes your blood vessels to constrict and your kidneys to retain sodium. Both of these things increase your blood pressure. Plus, that sugar is inflammatory. It damages the lining of your blood vessels, promotes plaque buildup, and makes your arteries stiff. If you drink 1 soda per day, you're consuming approximately 4,000 milligrams of sugar per week, or about 500 grams. That's equivalent to consuming 1 pound of sugar every single week. Diet soda isn't the answer, by the way. The artificial sweeteners in diet sodas can also increase blood pressure by triggering your taste receptors and causing your body to expect sugar, which increases insulin resistance. Here's what I tell my patients. Eliminate sugary drinks completely. Switch to water, herbal tea, black coffee, or unsweetened beverages. Your blood pressure will drop noticeably in just a few weeks. This is one of the fastest ways to lower your blood pressure without medication. And number 1, the worst offender, the food that shocked me the most when I really started looking at the data, is restaurant food in general. Here's the thing about restaurants. The chef's job is to make your food taste amazing. The best way to do that is with salt, fat, and sugar. These 3 things are addictive and delicious. So restaurants use them liberally. A single meal at an average restaurant, just 1 meal, not a whole day, can contain between 2,000 and 4,000 milligrams of sodium, sometimes more. That's a full day to almost 2 days worth of sodium in one sitting. The problem is that people eat restaurant food without realizing what's in it. You don't taste the salt in a grilled chicken breast because it's been heavily salted. You don't taste the butter in the vegetables because it's blended in. You don't taste the sugar in the sauce because it's subtle, but it's all there. Plus, restaurants use industrial ingredients with lots of additives and preservatives. Many of these additives increase inflammation in your blood vessels and contribute to high blood pressure. Here's what I recommend. Cook at home as much as possible. When you cook at home, you control the salt, the fat, and the sugar. You know exactly what's going into your body. If you do eat at restaurants, ask how the food is prepared. Ask for sauces on the side. Ask for grilled instead of fried. And limit restaurant meals to maybe once or twice a week. Okay, so I've told you what to avoid. Now let me tell you what to eat instead, because this is where the magic happens. The foods that actually lower your blood pressure. Eat vegetables, especially leafy greens like spinach and kale. These are high in potassium, which counteracts sodium and helps relax your blood vessels. Eat whole grains like brown rice and oatmeal. These are high in fiber, which helps regulate your blood sugar and reduce inflammation. Eat legumes like beans and lentils. These are high in protein and fiber and have virtually no sodium. Eat berries, which are high in antioxidants that protect your blood vessels. Eat fatty fish like salmon and mackerel, which are high in omega-3 fatty acids that reduce inflammation and improve blood vessel function. Eat nuts and seeds, which are high in magnesium and potassium. Drink plenty of water. And most importantly, cook your own food so you control the ingredients. Here's something that motivates my patients. If you eliminate these 10 foods and switch to the healthier options I mentioned, you can lower your blood pressure in as little as 2 to 3 weeks. Not months, weeks. Most of the sodium in your diet comes from these processed and restaurant foods. When you eliminate them, your body is able to regulate your fluid balance much more effectively. Your blood vessels become less inflamed. Your arteries become more flexible, and your blood pressure drops. I've seen patients drop their blood pressure by 10, 15, 20 points in 3 weeks just by changing what they eat. And here's the really encouraging part. It keeps getting better. After a few months, many of my patients are able to reduce or eliminate their blood pressure medication entirely. Now, I know this all might sound overwhelming. You're thinking, Dr. Westbrook, am I never going to eat any of these foods again? No, that's not what I'm saying. I'm saying that these foods should be exceptions, not the rule. Start by choosing 1 or 2 of these foods to eliminate. Don't try to change everything at once. Maybe this week you stop eating deli meats and switch to homemade chicken for your sandwiches. Next week, you eliminate soda and switch to water. The week after, you reduce your cheese intake by half. Small changes add up to big results. And I promise you, when you start feeling better, when your energy increases, when your doctor tells you that your blood pressure has dropped, it becomes much easier to stay with the program. Also, talk to your doctor before making major dietary changes, especially if you're on blood pressure medication. As your blood pressure drops, your medication might need to be adjusted. You don't want to suddenly be taking medication that's too strong for you. Here's why these dietary changes work so dramatically. Your blood pressure is controlled by 3 main factors: the amount of fluid in your bloodstream, the strength of your blood vessel walls, and how easily your blood can flow through your vessels. When you eat too much sodium, your kidneys struggle to excrete it. Your body retains more water to dilute the sodium. This increases the total amount of fluid in your bloodstream, which increases pressure on your artery walls. When you eat saturated fats and processed foods, you develop inflammation in your blood vessels. This inflammation makes your arteries stiff and less flexible. Stiff arteries don't expand and contract as easily, so they can't regulate pressure as well. When you eat sugar and refined carbohydrates, your blood glucose spikes. This causes your body to release insulin and stress hormones. These hormones constrict your blood vessels and increase the force of your heartbeat. Both of these things increase your blood pressure. But here's the good news. All of these effects are reversible. When you change your diet, your body starts healing immediately. Within a few days, your kidneys start regulating sodium better. Within a couple of weeks, the inflammation in your blood vessels starts to decrease, and your blood pressure starts dropping. Let me tell you about a few of my patients who made these changes. There's Mark, a 52-year-old guy who was eating fast food 5 days a week. His blood pressure was 160/100. He was on 3 different medications. I asked him to eliminate fast food and cook at home. He did. In 6 weeks, his blood pressure dropped to 138/88. He's now on 1 medication instead of 3. Then there's Sarah, a 48-year-old woman who was eating a salad with creamy dressing, a sandwich with deli meat, and a soda every single day for lunch. Those 3 things alone were contributing about 2,500 milligrams of sodium per day. I asked her to switch to a homemade salad with olive oil dressing, grilled chicken, and water. In 3 weeks, her blood pressure dropped from 142/92 to 128/84. These aren't special people. They didn't have superhero genetics. They just changed what they ate. And their bodies responded. Your body can respond the same way. Now, I know that changing your eating habits is hard. Let me address some of the common obstacles I hear from my patients. First, people say, "But I'm too busy to cook." Here's what I tell them. Cooking is faster than you think. A simple stir-fry of vegetables and grilled chicken takes 15 minutes. A salad takes 5 minutes. Even if you spend an hour on Sunday making 5 days' worth of meals, that's a tiny time investment compared to the time you'll save by not being sick or dealing with complications from high blood pressure. Second, people say, "But restaurant food tastes better than home-cooked food." That's because restaurants use tons of salt, fat, and sugar. Your taste buds are hijacked by these flavoring compounds. But here's the thing. When you eliminate processed foods for a few weeks, your taste buds reset. Suddenly, a piece of fresh grilled chicken tastes amazing. A salad tastes delicious. Your taste buds become sensitive to real flavors again. Third, people say, "But my family won't eat this food." So include your family. Your spouse and your kids need to eat better too. Everyone benefits from eating less salt, less processed food, and more vegetables. You might think your kids won't eat vegetables, but if that's what you serve, and you don't give them processed alternatives, they'll eat them. Fourth, people say, "But I love cheese." Great, eat cheese, but eat smaller portions and choose lower sodium options. You don't have to eliminate the foods you love. You just have to moderate them and be mindful of how much you're eating. Let me tell you what not to do, because I see people making these mistakes all the time. Don't go on some extreme restrictive diet. That doesn't work. You'll stick with it for a week, then you'll go back to your old habits. Instead, make gradual changes that you can sustain for life. Don't rely on salt substitutes. Most salt substitutes contain potassium chloride, which sounds healthy but can actually be dangerous if you have kidney problems. Plus, they often taste bad, so people use more of them to compensate. Just use less salt. Don't assume that if it says low fat, it's healthy. Low-fat foods often have added sugar to compensate for the fat. They're not better for your blood pressure. Don't expect medication alone to fix your blood pressure. Medication is important if your blood pressure is dangerously high, but medication treats the symptom, not the cause. Food is the cure. If you make these changes, if you eliminate the 10 worst foods and switch to a diet rich in whole foods, vegetables, and lean proteins, here's what's going to happen to you in the long term. Your blood pressure will normalize. Your cholesterol will improve. Your risk of heart disease will drop dramatically. Your risk of stroke will decrease. Your kidneys will function better. Your energy will increase. You'll lose weight. You'll sleep better. Your brain will function better. And you'll feel amazing. Plus, you're going to extend your life. People with untreated high blood pressure have a much shorter lifespan. But people who manage their blood pressure through diet and lifestyle live longer, healthier lives. Isn't that worth changing what you eat? Here's what I want you to do. First, watch this video again and take notes on the 10 foods to avoid. Second, go through your kitchen and look at the labels on the foods you're eating. Pay attention to the sodium content. You might be shocked at what you find. Third, pick 1 or 2 of these foods to eliminate this week. Just 1 or 2. Fourth, find 1 new recipe that you want to try. Something with vegetables, whole grains, and lean protein. Fifth, if you're on blood pressure medication, schedule an appointment with your doctor to discuss the changes you're planning to make. And finally, come back and let me know how you're doing. Leave a comment below and tell me which of these foods you're eliminating first. Tell me about your results. Share your story. Because when you do that, you inspire other people to make the same changes. And together, we're going to lower the blood pressure of millions of people and prevent heart disease and strokes. High blood pressure is called the silent killer, because most people don't know they have it until something bad happens. But you're not going to be one of those people. You're watching this video because you care about your health. You want to live a long, healthy life. And here's the truth. Your body is incredibly powerful. It wants to be healthy. It wants your blood pressure to be normal. All you have to do is stop eating the foods that are working against it and start eating the foods that support it. These 10 foods that I've talked about today are the biggest offenders. They're driving up blood pressure in millions of people. But they're not the only options. There are thousands of delicious, healthy foods that are good for your blood pressure. You have the power to change your health. Not in months or years, but in weeks. 2 to 3 weeks. That's all it takes to start seeing results. So start today. Pick 1 food to eliminate. Make 1 change. and then come back and let me know how you're doing. Thanks for watching. If this video helped you, please like it and subscribe to the channel. It helps me reach more people with important health information. And if you have questions about your blood pressure or any of the foods I mentioned, leave a comment below or talk to your doctor. I'm Dr. Ryan Westbrook, and I'm here to help you take control of your health. Let's do this together.